Well, hi everyone. I'm Andy Asher. I'm editor of Bloomer Boomer. This is goes 3 days a week. It's part of the Plus 50 Good Life movement. Now, Medicare is what we're talking about today. It can be a great, vexing puzzle, but it's also a game changer every single day for thousands of people turning 65 years old who now qualify for federal health insurance programs. Now, over at Kiplinger, the Washington, D.C. based publisher of business forecasts and personal finance advice, they report about all things Medicare. And their contributing editor is Kim Lankford, who does the Ask Kim column for Kiplinger's Personal Finance. Kim is also featured as a financial expert on television and radio, including NBC's Today Show, CNN, CNBC, and National Public Radio. Now, we're going to talk to Kim in just a moment about the article that she wrote. It's and hopefully you'll check it out. It's FAQ about Medicare, and we're going to do that. We'll be right back. Now, our shows are about the Good Life movement at Bloomer Boomer. It's a Good Life Plus 50 movement, for now evoking the things that make for a good life 50 plus. Part of the Bloomer Boomer project. The shows are about what's working and what's not working and how to make the best of it. And in the end, hopefully something you can take away for yourself. Our guests are idea and thought leaders, experts, people with life experiences to emulate, folks with a unique expertise, or those that give us one of those aha moments or a revelation that can suddenly transform the complex and bewildering into the understandable, you might say. And so, talking about the understandable, we're going to talk to Kim Lankford, contributing editor for Kiplinger Personal Finance, who wrote the article FAQs about Medicare. And Kim, thanks so much. It's great having you here. And, let me tell you, before we were going to get together, I was thinking about this whole issue. And, Medicare can be great and wonderful and also can be frustrating and puzzling. And I loved your FAQs on Medicare. Your readers must find some things that are more puzzling than others. So you probably hear more of the more puzzling ones more often, don't you?
It's actually pretty simple to sign up, but you're right. You do get inundated with so many things, especially about policies that can fill in the gaps. And those are some other key decisions to make at that time. Filling in the gaps,
that little point makes a lot of difference. They call it gap coverage. What does that mean, basically?
Well, there's a few key things that Medicare doesn't cover. Medicare covers really the bulk of your medical expenses. Medicare Part A covers hospitalization. Medicare Part B covers doctors' services, x-rays, other outpatient services. But there are some big gaps. You generally have to pay about 20% of those doctors' services and other outpatient expenses. There's co-payments for hospital stays. There's a deductible for both Part A and Part B. And Medigap policies are one way to fill in the gaps. You have three choices for filling in the gaps. If you're lucky enough, you may have retiree coverage through your employer, which is great, but unfortunately, many people don't have those options anymore. You could buy a Medigap policy from a private insurer, or you could get a Medicare Advantage plan, which covers both your drug and your medical costs from a private insurer. Another key thing to keep in mind with Medicare is it does not cover outpatient prescription drugs at all. So you either will need to get that coverage as another separate policy, a Part D policy that you can buy on its own, or you can get that coverage along with your medical coverage through Medicare Advantage. So kind of a smorgasbord of letters and plans to keep in mind, but you do have lots of different options.
And there are some deadlines that are important. If you don't meet them, you pay a penalty. Could you talk about that?
Well, if you are signing up at 65, so unless you have coverage through a current employer, you really need to sign up for Medicare Part A and Part B at age 65. And even if you are still working and have coverage through your employer, if your employer has fewer than 20 employees, then you still should sign up for Medicare at 65. There's a few exceptions. Some employers let your coverage from your employer count first and Medicare counts second if they're those small employers. But generally, you still need to sign up for Medicare. Now, the one exception is if you work for an employer with more than 20 employees. Generally, as long as you're still working and have that employer coverage, you can wait to sign up until you lose that coverage, until you finally retire, no matter what age that is. But at that point, you need to sign up within 8 months of leaving your job, or else you could get stuck with penalties and could have some gaps in coverage. So you really just that very first sign up period is really important. Well, the good thing is right when you're signing up for Medicare that first time, whether it's when you're 65 or after you leave your job, that's when you should sign up either for your Medigap plan or Medicare Advantage plan or Part D as well. If you do that soon after signing up for Part B, that's the best time and you don't have gaps. But then the good thing with Part D and Medicare Advantage is every year there's an open enrollment period. And so you can always switch plans. And it's really important every year to go to medicare.gov/find-a-plan. It's called the Medicare Plan Finder, and you can see all of the Part D prescription drug plans and Medicare Advantage plans that are available in your area and figure out which one is the best for you. And open enrollment every year runs from October 15th to December 7th, and the coverage then will start at the beginning of the next calendar year. So don't miss that period because you may end up not being with the best plan for you. It's always really good to be able to check all those options, even if you've been happy with the plan you have.
And you know, a lot of times you find out, oh my gosh, my doctor isn't in my plan. Then what can you do about getting what you want?
The good thing is if you do stick with traditional Medicare and then buy a Medigap policy to fill in those gaps in a Part D plan for drug coverage, then you can generally have coverage from any doctor who accepts Medicare, and that's most doctors. If you get a Medicare Advantage plan, your premiums generally will be lower than the combination of those three other plans. However, they usually have limited numbers of doctors and providers and hospitals. It's much more like an HMO or a PPO that you may have had before you were on Medicare. It's a good way to save money if you're comfortable with that, but you can have the problem with doctors coming and going from those plans. So it's really important every year to make sure your doctor continues to be covered. The hospitals where you would like to be treated if something major crops up during the year continue to be in that plan's network. And that's something that you can check out when you're comparing those plans during open enrollment.
What about the high price of drugs? Is there something, prescription drugs, is there something that you can do to control that under Medicare?
Well, that's another key thing is when you're looking at those Part D plans every year, look at specifically not just premiums, but how much your specific drugs cost under those plans. And the great thing is that Medicare Plan Finder at Medicare.gov has a tool that lets you input your drugs and dosages, and you can see exactly what your co-payments would be under each of those plans and how much you would be paying out of your pocket by the end of the year. Now, this may change from year to year. You may be prescribed new drugs, or plans can also change the co-payments for specific drugs from year to year as well. Sometimes they may even drop drugs from their formulary, which is the list of drugs that they've covered. So once again, during open enrollment, it's really important to consider those plans available in your area and look at those overall costs. Another key thing to consider, apart from open enrollment, is just to talk to your doctor about some of your alternatives. Find out if there's any therapeutic alternatives, which is, if there's a generic alternative, that's always great. That's going to save you a lot of money. But a lot of times, there may not be a generic equivalent of your drug, but there may be another very similar drug that can solve a lot of the same needs, but may not be specifically a generic. Ask your doctor about some of those drugs because there still may be much lower out-of-pocket costs for that drug than the drug that you're currently taking.
Well, that's fascinating and good information. And if for folks that might have questions and so on and so forth, any advice on that?
Well, a few key things. Every state has a SHIP. It's a state health insurance assistance program. And if you go to shiptacenter.org, or if you call 1-800-Medicare, they can give you the name of the local one in your area. And those people there are just wonderful volunteers, trained to help people make Medicare decisions, also familiar with the Medicare options in their area. Also, the Medicare Rights Center, and it's medicarerights.org, is a wonderful resource. Their Medicare interactive tool has so many questions and answers specifically about Medicare. And then you can also go to Kiplinger.com. I've done a lot of articles about Medicare, so have some of my colleagues. I do the Ask Kim column there and answer a lot of readers' questions about Medicare and so many related issues.
Well, fantastic. Kim, thanks so much. Learned a lot, and it's a big topic. It's hard to cover it all, but it sounds like you've at least done that with your people when you ask questions. Thanks a lot.
Oh, thank you very much for having me.
All right. Well, thanks again, Kim Lankford, contributing editor for Kiplinger Personal Finance, who wrote the FAQs about Medicare. And like I was saying to Kim, you can never know too much about it. That's our show for today. I hope you liked it and learned a thing or two. The full show will be available on YouTube and at Bloomer Boomer. The audio version will be available on Apple Podcasts or iTunes, and we have other shows coming up with some amazing guests. Please like us on Facebook and visit us at the bloomerboomer.com website. Thanks a lot. Bye-bye.